You're sitting at the kitchen table sipping your morning coffee, reading the newspaper when your hand suddenly slips. The cup falls. You try to speak, but the words don't come out right. Your tongue feels heavy. Your arm won't move. The clock keeps ticking. 3 minutes pass, and everything changes forever. If you've ever feared this moment, you're watching the right video. Because today, we're revealing what doctors call the golden 3 minutes, the small window of time when your body is crying for help, and you can still save your brain, your speech, your memory, your life. I've seen it too many times. Seniors who looked perfectly healthy just hours before, suddenly unable to move or talk. Family members frozen in panic, waiting for help. But what if you knew exactly what to do before the ambulance even arrived? I'm Dr. Howard Miles. I've been practicing neurology for over 4 decades, and what I'm about to share isn't rumor, it's real science. Taught quietly in medical schools, confirmed by hospitals like Mayo Clinic, Cleveland Clinic, and Johns Hopkins. This is the same 3-minute technique that has helped countless people survive the first signs of a stroke, and sometimes walk again when others couldn't. But here's the shocking truth. Over 70% of seniors don't recognize a stroke when it's happening. According to the American Stroke Association, someone in the United States suffers a stroke every 40 seconds. Every 3.5 minutes, one person dies. It's the 5th leading cause of death, and yet 80% of strokes can be prevented with simple awareness. So why don't we talk about it? Because strokes don't always look dramatic. They can begin quietly, with confusion, slurred words, a drooping smile, or numbness in one side of the face. Signs are often mistaken for fatigue, dizziness, or old age. And by the time most people realize what's happening, it's already too late. But the body gives you clues, and if you learn to read them, if you act fast, within those first 3 minutes, you can give doctors the head start they need to save your brain. Let me take you back to one of my earliest cases. A 74-year-old retired teacher, Mrs. Coleman, was gardening one morning when her right hand went weak. She felt dizzy, then sat down, assuming she was just dehydrated. But her husband noticed something strange. Her smile looked uneven. Her words slurred slightly. He remembered something I'd told him just weeks before. If you ever see one side of the face droop, even a little, don't wait. It could be a stroke. He immediately performed what I call the 3-minute trick. He had her sit upright, tilt her head slightly forward, and take slow, controlled breaths. This helps maintain blood flow and oxygen. Then he gently asked her to lift both arms. When her right arm couldn't stay up, he called emergency services, and crucially noted the exact time her symptoms started. When paramedics arrived 6 minutes later, that single detail, the onset time, determined everything. They administered a clot-busting treatment called TPA within the golden hour. 3 days later, she was walking again. She survived because her husband didn't panic. He followed the 3-minute awareness rule, a combination of recognition, positioning, and precision timing. Now let's break this down, step by step, the same way I teach my students and families of at-risk seniors. Step 1. Recognize the first silent signs. You don't need a stethoscope, just your eyes and ears. If someone suddenly looks off, ask 3 quick questions. Smile. Does one side droop? Speak. Are the words slurred or strange? Lift. Can both arms rise evenly? This is called the FAST test. Face, arms, speech, time. It's simple, but powerful. According to Harvard Health Publishing, recognizing these signs and calling emergency services within 3 minutes can double the chance of survival and reduce brain damage by up to 60%. Step 2. Keep the head slightly elevated, never flat. This helps reduce pressure in the brain and maintain blood flow. According to Johns Hopkins Medicine, lying a stroke patient completely flat can worsen swelling in certain cases. The best immediate posture? Sitting up at a 30-45 degree angle, calm and steady. Step 3. Record the time, to the minute. This is crucial. Doctors call it the onset marker. The stroke clock starts the moment the first symptom appears. When paramedics know that time, they can instantly decide if life-saving medication or clot retrieval procedures are still safe to use. But here's the part no one talks about. Many people, especially seniors living alone, delay help because they don't want to bother anyone. They wait it out, hoping it's nothing. That waiting is deadly. According to the Cleveland Clinic, brain cells start dying within minutes of oxygen loss. about 2 million neurons per minute. Every second counts. The sooner you act, the more of your brain you save. Tell us your age and where you're watching from. We read every comment. And if this information could save even one life, hit like so more seniors can see it. Now, let's go deeper into what actually happens during those first 3 minutes. A stroke is a sudden interruption of blood flow to the brain. Most are ischemic, caused by a clot blocking a blood vessel. Others are hemorrhagic, caused by bleeding from a ruptured artery. In both cases, brain tissue is deprived of oxygen and nutrients, and neurons begin to die. But before that damage becomes permanent, the brain sends distress signals: weakness, numbness, speech problems. That's your window, your 3-minute warning. Here's the surprising part. Research from the Mayo Clinic 2023 found that more than half of seniors who suffered mild or transient strokes, called TIAs, transient ischemic attacks, didn't seek immediate help. Yet, nearly 1/3 of them had a major stroke within 90 days. That's why doctors call TIAs mini-strokes with major warnings. If you ever experience sudden confusion, vision trouble, dizziness, or imbalance, even if it disappears within minutes, treat it as an emergency. It's not anxiety. It's your brain begging for attention. Most people miss this because symptoms fade too quickly. But those early minutes are your chance to rewrite the outcome. Here's what the American Heart Association recommends. 1. Call emergency services immediately. Don't drive yourself. 2. Note symptoms and onset time. Write it down or tell someone. 3. Keep the person safe and upright. 4. Avoid food, water, or medication unless prescribed. 5. Stay calm and talk softly. Panic increases blood pressure and strain. In those first few minutes, your goal isn't to treat, it's to buy time. That time is everything. And here's something few people know. Even after the stroke begins, the brain can reroute some blood flow through collateral circulation, tiny backup vessels. Staying calm, sitting up, and breathing slowly helps those vessels stay open longer, preserving more brain tissue until professional care arrives. It's why the University of California, San Francisco calls calm breathing a neurological first aid. 3 minutes of awareness can preserve decades of memories. Let's return to Mrs. Coleman. A week after her recovery, she told me something that stuck with me. She said, "Doctor, I didn't know what was happening, but my husband's calm voice made me believe I'd be okay. That saved me as much as the medicine did." And she's right. The human brain responds to calmness the way a drowning person responds to air. It's not just biology, it's survival. Here's another true story. A 67-year-old man named Peter collapsed while playing cards with his grandson. The boy noticed his grandpa's smile looked funny. He remembered a school poster about fast, and within 2 minutes, called for help. That call saved Peter's life. By the time he reached the hospital, doctors could still use a clot-dissolving drug safely. Today, he's walking, talking, and mentoring stroke survivors. All because one child noticed what many adults might ignore. That's why awareness matters. Stroke doesn't care about age, gender, or wealth, but knowledge protects everyone equally. According to World Health Organization data, up to 90% of strokes are linked to controllable factors: high blood pressure, smoking, inactivity, poor diet, and undiagnosed diabetes. But emergency survival, that 3-minute trick, is universal. Here's how to remember it simply. Recognize. Fast, face, arm, speech, time, react. Sit up, stay calm, call for help. Record. Note the time symptoms began. 3 steps, 3 minutes. 1 life, yours. And even if you never experience it yourself, learning these steps could make you a hero for someone else. Your neighbor, your spouse, your best friend. Someone you care about could truly benefit from your calmness in those crucial moments. So take this as your mission. Spread awareness. Talk about it with your loved ones. Teach your grandchildren how to recognize the early signs. Keep the reminders visible, because when unexpected moments happen, staying calm and aware can make all the difference. Remember, good health starts with awareness. Every person I've met who recovered early had one thing in common. Someone nearby noticed the warning signs quickly. If you ever notice something unusual, but a smile that looks uneven, speech that sounds different, or a sudden weakness, don't ignore it. You're not overreacting. You're being smart and prepared. Share this video with someone you love. The next story of awareness could be theirs. And for more helpful insights on health, longevity, and senior wellness, subscribe to our channel. Your heart and your loved ones will thank you.